Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center on the coronavirus. Today is Monday, May 11th. In the local counties, we are reporting 3,165 cases of patients who have tested positive for COVID-19. Inside here in the medical center, we currently have 46 patients that we're treating. 34 are on the floor, 12 are in the ICU, and Fred, 5 are on ventilators.
That's right.
We'll give a little breakdown on the ages a little bit later in the presentation.
Yes.
There's a graph that we've been sharing recently that shows the cases in-house, and there's a purple line there. Fred, I think if we take a look at that over about the last month, we're seeing a linear line.
It really is. There's one day early in April that's a little bit higher, but otherwise our admissions look really flat for more than a month now.
We talked about this last week, and we talked about how we were going to start talking about the number of cases, not only here in the medical center, but also within the region.
That's right, Dennis.
And this is important because as they talk about reopening for business the different regions of the state, that the number of hospitalizations and the number of deaths would be something that they would take into consideration as they talk about reopening the regions. Our region has 8 counties in it. So going north to south, we're talking about Warren and Washington, Saratoga, Schenectady, Rensselaer, Albany, Columbia, and Greene. And each morning, Fred, you lead us through a conversation of CEOs of local hospitals that talk about admissions to their hospital. And what do we hear this morning?
So, Dennis, you're right. We actually share information. We've been doing this literally now for almost 2 months. So on Thursday last week, we started sharing the number of admissions from those 8 counties. So today, we actually look back 3 days, so Friday, Saturday, and Sunday. And total for those 8 counties, there were 17 admissions to the 11 hospitals that report.
Now, to me, that sounds like a low number.
It is a low number, Dennis.
And so we're going to see how this number translates into that grid that we showed last week that talks about whether or not counties are able to open up.
That's right. I think we need a little clarity exactly what data the state's looking at. They're probably also going to refresh their data, I would assume sometime this week. So we'll see what it shows.
On a going forward basis, we could even begin to report out here the rolling 3-day number of admissions to those counties.
We can absolutely start doing that.
Okay.
We have the data.
We have the data. Very good. Another topic that we talked about last week that we'd like to pick up again today is safety. And we have been emphasizing for quite some time now that we believe that we're providing very safe care here within the hospital as well as in the practice locations. And Fred, I think you were going to articulate for us some of the things that we've been doing that we think means that this is a safe environment to get care.
Absolutely, Dennis. So when you come to the facility, first of all, we have visitor restrictions. So only certain people can come in. So the ability for the virus to get in from outside is diminished by that. Secondly, if you are somebody who can come in, a visitor that's allowed or an employee, we temperature and symptom screen to make sure that they don't have a fever or have symptoms of corona. We're telling our employees not to work while they're sick, yes. So we're encouraging them to stay home. We have been putting up plexiglass barriers so that when you come to a registration desk or a checkout area, there's a physical barrier as well. And we've been encouraging and really promoting hand washing and have hand washing stations throughout the facility to encourage people to keep their hands clean.
And I think the truth is that there's a lot of businesses out there that are really for the first time getting into the practice of trying to do things safe from a medical standpoint. But as a hospital, we've been doing this forever. I mean, we have seasonal flu, we have other infectious diseases, we have experts who help guide us in decisions about wearing protective equipment. We've always done that.
That's right.
COVID-19 is a new pathogen, but the practice of how we do this and how we keep people safe, this is something we've always done.
We take care of, obviously, people with the flu, even very serious flus. If you go back a decade or so, H1N1, SARS epidemic, we have practices and processes to keep our staff safe as well as our patients safe.
And if we're being honest, this is not just about Albany Medical Center, but everywhere in the state, in the country, even in the world, people have said, Fred, that they're afraid to come back.
Yes.
And some people have said they're afraid even to undergo surgery that they need to have. Can you talk a little bit about what we do to keep our operating rooms safe?
So we clean them, as you would imagine, Dennis, quite extensively. We allow a certain amount of airflow after they're cleaned to take any particle that might be aerosolized out of the room. They all have a certain number of air exchanges per minute, which is very important in keeping them clean. So it's a safe, sterile environment, and that's always the way we treat our operating rooms.
And finally, we did start today doing these medically necessary procedures over at South Clinical Campus. How's that going?
It's going well. We started at South Clinical. We chose South Clinical because it's about a mile away from the main campus. It's a full-service facility with both intake and recovery area, and we're testing all those patients so that we know they don't have COVID when they go there.
Okay. We're going to keep talking about this every day this week, and in fact, we'll be out in the public with this a lot more. I mentioned that we're going to talk about the demographics of the people who are currently here in the hospital. Of the 46 people that we're currently treating for COVID-19 inside the medical center, the youngest person is 28. There's also somebody who's 35, and then 42 of the remaining 46 people are over the age of 50, and half of all the patients are over the age of 70. So I think this is consistent with what we've read out there, that by and large, this seems to be something that, from a hospitalization standpoint, seems to be affecting people who are in the older age group.
That's right, Dennis. Our experience is being replicated at other institutions in our community and I think around the country.
And this is also important because of some of the recent media attention on Kawasaki's, which we spoke about last week. I know, Fred, this weekend there was a request for us to submit data to the state as they're looking at whether or not there's any linkage potentially between COVID-19 and Kawasaki's. We're starting to submit that data.
We are. And, I would emphasize that every year we see children with Kawasaki's. It's usually self-limited and they recover without incident. This year is no different. Perhaps there is a connection, although that's not even certain, but the Department of Health is very interested in finding that out, so we're working closely with them.
We have the only pediatric emergency department. We have the only pediatric hospital, children's hospital around here. We don't have anybody currently in the hospital with COVID-19 under the age of 28. So that, I think, tells you a lot about what at least we're experiencing in this region.
We've had very few, just a handful of children admitted with COVID.
Very good. Fred, who are you wearing today?
I've got clinical engineering on. The clinical engineering folks fix things. They fix equipment that is very important to us in the organization. They've done actually something else very interesting and very important. They created a way for us to control ventilators outside of COVID rooms and infusion pumps. And so that's a tremendously important thing. It means less traffic in and out of those rooms for patients who have COVID. So shout out to clinical engineering.
They do a remarkable job. I have on a shirt for the Albany Med Foundation today. In many ways, they've been the connection with our community, who's been so gracious with their response to us. The foundation has coordinated all sorts of gifts, including over 130 food donations here. They've worked with University of Albany and others at the creation of the 3D face shields for us. They've coordinated with CEFCU and the Hilton Garden Inn on Heroes Landing. They've done all sorts of great things. They've even applied for some grants for us.
They have.
So we appreciate all the great work of the foundation.
They're tremendous.
So that's going to wrap up today. The theme all week is going to be regional data. We're going to look very carefully at regional data and try to report that out to you. And we're going to continue to drive home the message that it's safe to get your care taken both inpatient and outpatient here at the medical center.
That's right.
Okay, very good. That wraps it up for Monday. We'll be back again tomorrow. As always, we ask that you please take care of yourself, take care of each other, and we'll see you tomorrow.